But
Go.
Okay. So what schooling is required to become a hospice nurse?
You need to be a registered nurse, so that means anywhere from 2 to 4 years of training to become a registered nurse, depending on the school you go to. Many hospice organizations require that their nurses be trained as with a Bachelor of Science degree, and once you become a hospice nurse, many of those nurses choose to go on and get a special certification in hospice nursing.
Okay. So what is your, oh goodness, I'm gonna mess this up. What is your specific experience with smoking patients? So do you have a lot of patients who have smoking related illnesses?
Mm-hmm. And I do. I have, I'd say at least a third of my patients require oxygen because of either having been former smokers or currently smoking, you know, with diseases such as COPD or lung cancer.
Okay. So can you define for me what COPD and emphysema are and what they do to the patient?
Mm-hmm. Well, COPD stands for chronic obstructive pulmonary disease, and it includes emphysema. And basically, what happens is the lungs lose their capacity to hold air. So you have a very difficult time breathing. Many times there's a lot of secretions that build up, so there's a chronic cough. And it limits your life in many ways. You just don't get to walk like you used to. Many times you don't get to talk like you used to. You get breathless, even breathless with eating.
So would you say that it affects people's lives and that it limits what they can do?
Absolutely, in so many areas, in so many ways.
So what is the goal of hospice in working with the patients and with their families?
Well, when hospice comes in to work with a family, it's a team of people. It's a nurse, a social worker, a chaplain, and a hospice aide, and many times a hospice volunteer. So the team comes in. If the family is at home, then we're really there to support the family in providing the best care for the patient. We provide medications, medications that help control symptoms and that make the patient more comfortable. We provide personal supplies, adult briefs and soaps and to keep the patient clean. We provide equipment like the bed and oxygen and maybe a wheelchair. And we provide just a lot of physical and emotional support for both the family and the patient to help that patient be comfortable, to maintain for as long as possible some quality of life, and when the time comes to help them just pass as peacefully as possible.
So what are your personal views on smoking?
Well, I don't smoke. I've never been a smoker, and I just feel that it's my obligation to set an example to patients and an example of health to the best of my ability. And at the same time, I know that what I understand is this smoking is a very difficult addiction to deal with. Probably the most difficult addiction to turn away from. And I'm gonna take care of patients who are dying from that disease. So I have to approach it with compassion.
Do you have any experience with smoking? Do your family members or other relatives?
Well, when I was growing up, I lived with 2 smokers, my parents. I don't think they smoked through my whole youth, you know. And they were smoking when I left the house at 20. And I have relatives now who are smoking. I have a cousin who has COPD and is being treated for lung cancer. But thankfully, none of my children smoke.
That's always good.
And my parents have quit many years ago. So.
That's always good. Are you yourself affected by smoking at all?
No, gratefully I'm not.
That's always good.
Mm-hmm.
I'm really glad to hear that. that.
Thank you.
So do you work with a lot of patients? You said probably about a third of your patients are smokers. What are they affected by?
Lung cancer. I'm taking care of a few patients with lung cancer, COPD, and emphysema.
And what is emphysema specifically?
Well, emphysema is a disease that affects the ability of your lungs to breathe for you. And so you lose your ability to function in life. You can't walk without stopping to take a breath. Many times you can't even have a conversation with a person without stopping after a few minutes to catch your breath. Often eating a meal can just leave you breathless. And eventually, you can't leave your house, and then you can't leave your bed.
So what is the goal of hospice working with patients?
Well, we want patients to continue to do the things that bring them a quality of life, that bring them happiness. So we might go in to take care of a patient, and that patient is used to, even with oxygen, used to getting out and going out to lunch with their wife. So if we can help them do that, provide oxygen tanks that are portable so that they can continue to do that. When they can't do that anymore, we just try to make them comfortable at home. Maybe our social worker might be there to help them see, okay, so maybe you can't do that activity anymore that brought you a lot of happiness or added quality to your life, or maybe there's something new that we can discover. Maybe there's something here in your home that can be your new goal or your new quality of life. Maybe we'll bring in a hospice volunteer to spend time with them.
So what do volunteers do specifically?
Well, all sorts of things. I have a patient right now who requested a volunteer to come in to help her put some scrapbooks together for her children. We might have a volunteer go in and read the newspaper to someone. Or a lot of times we might have a volunteer to go in and just sit with a patient who might be bedridden, but then the family member, the wife, can get out and go do some shopping or just have an afternoon to herself. So some respite for the family.
So you work with more than the patient, it's more trying to take care of the family and make sure that everybody's comfortable.
Absolutely. When we take on a new patient, it's the family.
Gotcha. Okay, well thank you so much for your time. Let me see this and let me make sure that I have